Hello, everyone. Very pleased to restart this conversation today, a conversation on the front lines, and very pleased to welcome you all to this Devex Roundtable that we are happily co-hosting with our partners at MSD for Mothers. This conversation is part of our Maternity Matters partnership that we have with MSD for Mothers and part of the Funding the Future series that's exploring how international donor funding is leveraging private sector engagement in reproductive, maternal, and child health. So before we start the session today and invite all of our panelists, you'll see we have about not less than 9 speakers for this session. We'll hear from lots of different people and many of the donor organizations that are involved in funding global health worldwide. I'd like to share a few takeaways from the previous sessions and really thank all the global experts, health workers, and DevEx colleagues who worked in preparing these sessions. For me, there was really 2 main key takeaways from the previous sessions that we can bring into this conversation. One is funding, really the lack of capacity and funding to enable health workers deliver quality of care for all. And the second point really is communication. So Ngozi said in the last point, communication is very important. And that is valid for the communication between the different stakeholders active in global health, in delivering local solutions for health, including international organizations, the private sector and civil society organizations and citizens. So to close our day on the front lines, we have gathered a group of participants to this roundtable conversation, which hopefully can serve as an important milestone to help bridge the funding and capacity gaps that have been highlighted in the previous panels that we heard from today. So for the audience that's following up online, you can join the conversation, ask questions today via the chat box on the platform or directly on Twitter using hashtag #OnTheFrontlines and hashtag DevExEvent. So to go back on the session specifically, we'll explore how improved data visibility and the sharing of best practices can be powerful drivers to further engage the private sector and really strengthen health systems and engage as many stakeholders as possible to deliver on the sustainable development goals, even during this COVID crisis. Just a few notes on statistics around funding and the challenges that we face in maternal and child health. We're looking at a review of reproductive, maternal, newborn, and child health funding published in The Lancet in the late 2018, estimates between $10 billion and $13 billion was spent on average by donor agencies worldwide between 1996 and 2016. Yet we know that this is not enough. And according to the World Bank, and we've heard representatives from the World Bank earlier today, according to the World Bank, there is a $30 billion annual gap in funding for reproductive, maternal, newborn child health. And COVID has meant that policymakers are facing an unprecedented challenge in financing for health and addressing the social and economic impact of the pandemic. I was reading an interesting piece just before Devex from analysts from Health Policy Plus, which is a USAID-backed project, and saying that just between 4 countries, which are Indonesia, Pakistan, India, and Nigeria, if we're not adapting public policies and responding with localized solution, we'll see a 31% increase in maternal and child death in the coming year due to the pandemic. So it's really important to get this right and engage the right stakeholders in this response. So just to close on this introduction before I introduce our first speaker today, we want to encourage strategic engagement of the private sector capacity, especially local private sector, to help address the needs in maternal and child health in countries by tracking levels of current engagement and surfacing opportunities in these areas for the local private sector and for global private sector companies as well. So that's what we're trying to do here today. And we look at two areas we're specifically interested in. One is the data around financial partnerships and instruments that enable work between private sector and international donors. And the second one is investments engaging the local private sector. So without further delay, I'd like to introduce Marion Etiebet, who's the Executive Director of MSD for Mothers, which is a $500 million initiative that helps ending maternal mortality. So Marion, welcome to the session and to the event today. I'd like to start with a quick question for you. Why is your organization, why is MSD for Mothers so interested in this conversation? And why is now a good moment to engage in this group discussion? The floor is yours.
Well, thank you so much. Thank you so much for the question, Alex, and thank you for all of the other panelists on this roundtable. To answer your question really succinctly, we know that depending on the country and the region in the country, between 40 to 60 women and adolescents in low and middle income countries access critical family planning and maternity care services from local private providers. Whether these are local midwives in the community, local community pharmacists, local physicians, and during the COVID epidemic, that doesn't necessarily change. These local private providers are still either they're trusted or primary sources of receiving healthcare. You've shared, and I see Monique is, also on the panel, the alarm bells the community has been sounding about how the impact of COVID on the ability for women and communities to access essential health services. That is driven by both a lack of supply as well as challenges in demand for services because people are scared, to seek services. And it's become increasingly apparent from, my belief that local private providers can play a really critical role in the moment today where we're all experiencing the COVID pandemic of helping to augment government responses, both in terms of augmenting capacity to deliver services, but also augmenting the ability of government to communicate and reach out to women and communities and provide the information they need in order to safely access services. And so it's a really important conversation to have right now to understand the role of local private providers, understand the extent, of what they're doing, how they're doing, what they're doing, how well they're doing, what they're doing. And we shouldn't have to be recreating the wheel in the midst of an epidemic, of a pandemic. We hopefully would have had this data at our fingertips, understanding these networks of providers. So when there's an emergency, we can activate the on switch and, activate their support. And so what, we're really hoping we can come out of this roundtable with is, figuring out some best practices around sharing data about what we are already doing in terms of collaborating and working with local private providers so that when we need to activate that on switch, we can do so in a just-in-time manner. And also we can learn from what we're doing. We can learn what works, what doesn't work, where there are obstacles, to advance effective and impactful collaborations. And I do think that all of this starts with, understanding what's going on, sharing data, sharing experiences, and sharing the data in a way that's actionable for all of the parties involved. Thank you.
All right, thanks, Marion. Yeah, I believe that's a very important point, and I'd like to ask you to also share a few insights about a project you've been working on with Aderanke Saba, who's part of the panel, and we'll have a quick interview with Aderonke now, who's joining us from Kaduna in Nigeria, a city that's north of Abuja. And yeah, just a few words of intro for Aderonke and the work you're doing with together.
Great. Thank you, Alex, and welcome, Aderonke. So, as you mentioned, one of the partnerships that MSD for Mothers is involved is a partnership co-funded with the Gates Foundation, where we are supporting the capacity building of local community pharmacists and patent and proprietary medicine vendors. We know that they are an important source of family planning services and products in many communities. And the work that we've been doing, with these networks, including collecting digitized data on the services that they provide, is an example of how that data can be used to inform government responses in a COVID pandemic, understanding who needs what where, and what services, what services you need to help facilitate in order to meet the needs of women and communities. So great to see you, Aderonke.
Thank you very much.
Yeah, thank you so much for joining us, Aderonke, and thanks, Marin, for this short introduction of the project. Aderonke, you're a community pharmacist providing much needed medicines to people in your community. And I was wondering, as a private sector provider, what role do you play in your community health system, and especially through this project that you've been working on in the past months and years?
Okay, thank you very much, Alex. Beyond providing the much needed medicines needed by the community, we also offer primary healthcare services, one of which the family planning is part of, which is pretty much the main goal of the Integrate E project, which we're part of. Yes, the Integrate E project is focused on expanding access to quality family planning services. And within this project, one of the things that we do is that we go out into the communities and we create awareness. We create awareness. The contraceptive prevalence rate in Nigeria at the moment is at about 17%, while in Kaduna, where I currently practice, is about 14.9%, which is below the target, the national goal for 2020, and that's in Nigeria, which is set at about 27%. So you can see that the role of awareness advocacy cannot be overemphasized. So one of the things that we do is we go out into the community, create awareness, provide a lot of information and education. You will be shocked to find out that there are a lot of people that are aware of family planning services, but because of the wrong information that they have had over the years, they've developed a sort of apathy towards family planning services. So another thing that we do is that we provide information, give them the right education, tell them what family planning is and what it is not, what family planning does and what it does not do. And when we've, gotten them to that point where they now see family planning in a new light, we guide them on method choice, provide the service to them. And eventually we also, beyond all these services that we do, we also make sure that we document that these services are well documented.
Thanks, Aderonke. And I was wondering how you're partnering with the public authorities locally in your region. I understand you work a lot with local communities, and how is the articulation of your work with the public authorities, local authorities?
Okay. The Nigeria is a middle-income country with a population of about approximately 200 million, 49.5% of which are females. And a large percentage of that, they are women of reproductive age. And when you look at that amount and you try to compare it with the amount of the public health facilities you have in the country, you see that the public health facilities cannot possibly cater to the health needs of all the women. That's in terms of the family planning services. So pretty much what the private health sector does is we try to bridge that gap. And this project with this Integrate E project that is right now is with community pharmacists and the patent and proprietary medicine vendors. What Integrate E has done with this project is pretty much bringing family planning services home to the clients. Beyond those that are not aware, beyond those that are ignorant, there are people that are aware of this family planning services, but they are not able to access it. So, and those are people that you call, like, they're about 20%, we call it the unmet need. So what this project has done is it has made this service available, accessible to all those people. In Nigeria, you have pharmacies and PPMVs in pretty much every neighborhood and community. So you find out that these women are able to access the services. There is no, they don't have to deal with traveling long distances to the public health facilities. They also don't have to deal with the wait time. You have to go to these facilities, and because of the amount of people they have to attend to, you find out that you're spending a lot of time to access these services. But with this project that has, that is open to the community pharmacies and PPMVs, you'll find that people can access these services more easily. You can easily walk into the pharmacy that, on your street and access these family planning services in little to no time. Another thing that I think that this project has helped is that also helped to identify underlying health issues in women. In Nigeria, you find out that the average person doesn't, well, the average person, let me put it this way, doesn't go for medical checkups. The only thing that takes people to the hospitals is when they are ill, when they have certain symptoms and all. So what this thing has done, because before you can offer a service to any client, there's some basic medical checks that you have to carry out. I had a client some months back. She came into the pharmacy and she wanted to access the service, and carrying out these basic medical checks, we found out that her blood pressure was extremely high. And she came into the pharmacy, no symptoms at all, fine, hale and healthy, but her blood pressure was really high. And at that point in time, we had to refer her to a doctor for further evaluation, refer her to the public health facilities for further evaluation. If she had not come into the community pharmacy to access that service, she most likely would not have known that her blood pressure was that high, and except probably she would have should have most likely gone into an emergency situation.
Right.
But that was able to curtail that event. Yes, I'll say that what the private health facility brings, we are pretty much trying to bridge the gap. In a way,
Right.
also you could say taking the burden off the public health facilities.
Thanks so much, Adoranke. And I think it's a very interesting story, and bring it to real life example is really important for the roundtable conversation that's following. And I like the fact that you brought this example around diagnostics, which is very important one, especially in the COVID-19 era, even though it's on a different health issue, but it's definitely a place where the private sector can play an important role. So thanks so much for your contribution. Please stay with us in case we have questions for you later, Adoranke. And I'd like to briefly introduce our roundtable participants, as we have about 35 minutes to 40 minutes conversation ahead of us. And we have Suzanne, who's joining us from USAID. We have Bianca from the Global Fund, Monique from the Global Financing Facility, and Matt from the European Commission, Anshu from the World Health Organization, Annie from Grand Challenges Canada, and Desta is joining us from Kenya, and Amref Health Africa. So very pleased to welcome you all. And I'd like to start with a question directed to Bianca at the Global Fund, Bianca and Susan really, but I'd like to start with you, Bianca, as you've been with the Global Fund for 7 years now, working in the private sector partnerships team. So you've been with the Global Fund for quite a long time. It's one of the successful organizations partnering with the private sector in global health. And it'd be great if you could start off by telling us more about how the Global Fund works with specifically with local private providers as of today, and how you're leveraging private sector capacity to implement your work. I think it might go well in line with what Adoranke was just explaining. So.
Sure. Thanks a lot, Alexandra. And Marianne, Adoranke, thanks a lot for kicking us off. And I think you made a really important point, both of you, which is the need to involve local private sector providers. And with that meaning both the formal private sector, so the private health clinics and the private health facilities, but also the private sector. So including in some areas, I mean, drug centers, pharmacists, and others as well that may not be plugged into, let's say, the national health system in a very formal way. So there are different ways of how, especially local private sector, can get involved in program implementation. The most straightforward way, and I'm not sure how much everyone on the line and participants are aware of the Global Fund model, but the most straightforward way would be to be or to become a main implementer actually of a Global Fund supported program. So working with the Ministry of Health, working through the country coordinating mechanism. Sorry if I'm throwing out too many technical titles out there, but saying that we have seen that in several countries, it's not the norm yet, or it's not very often, but we've seen very successful examples of private hospitals, but also even local companies, for example, that have run a successful malaria prevention program for their employees and their communities, have actually scaled that up, working recipient of a Global Fund grant. So that's one very straightforward way, but in a much more general view, what we're also seeing is that the public-private mix in program implementation, and that actually starts, I mean, in the national disease strategies, and acknowledging the important role that local private sector has in many of the countries, mostly in Asia, but also in many different ways in Africa, sub-Saharan Africa too, and including that in the national disease strategies, but then also in the program implementation. So meaning that the public-private mix, and with all the challenges that brings, but also the opportunities, is absolutely key. And just to give you two examples, I mean, I can speak from the disease perspective, but as many of you will know, I mean, investing in health systems is absolutely key to the Global Fund model. And if we want to end the three main epidemics that we're focused on, TB, HIV, and malaria, but also, I mean, when you look at maternal health services, Marianne, to your point, and Adoranke as well, there's a lot that the public sector can learn from the private sector, and the integration again comes with other ways. So, for example, to speak about if we look at TB, I mean, if we look at a country like India, one of the TB high burden countries, where actually 2/3 of TB cases are notified through the private sector, or where, let's say, patients that have a chronic cough, as a first entry point, go to the private sector, both formal and informal. So it's absolutely key to, one, I mean, if you think of reporting, and I know we're coming back to that later in the discussion as well, integrating the private sector into national health information systems is super important, because then you get a sense of how many cases are we missing, where do we actually stand? Maybe we're not missing those cases, but they may get like the wrong treatment because they're not plugged into the public treatment protocols. So that interplay is absolutely key. And for example, with India, I mean, if we look at the programs that the Global Fund has been supporting, and you know, it's like a huge array of stakeholders there, working with the Ministry of Health in the leading role specifically, but this public-private mix, and also working with like a non-government intermediary, has actually proven quite successful. And just to give one more example, and I don't want to go into too many details either, but where we've also seen local private sector, and that also means the global private sector with local branches or local entities actually making a difference or adding a lot of value, is when you look at challenging operating environments, so conflict zones, countries where like national health systems are really extremely strained. Private providers, but then also, and that goes now beyond the health private sector, but also other companies in terms of warehouse management, supply chain management, actually can fill important roles there, especially when it comes to emergency responses and being part of it. So in closing, that close collaboration between public and private sector is absolutely key, and will even become more so across diseases and all health services.
Thanks, Bianca, for that. And yeah, it would be great to understand how you're also reporting on that and how private sector stakeholders can better understand where the opportunities are to help strengthen these partnerships. I'd like to go to Susan now, and I mentioned the USAID backed project in my introduction. Not necessarily on purpose, but it's great to have you here. And be great to learn more about the private sector engagement policy that USAID has put in place, and how do you measure that engagement with private stakeholders specifically?
Great, thanks so much for having me. I think many people know that we launched this private sector engagement policy in December 2018. And it really calls for a cultural and operational transformation within the agency. I am sure it's not surprising to anyone that we are quite a risk-averse agency, being part of the US government. And we believe that having a strong private sector will help us reach our goal of ending the need for foreign assistance. So, you know, many people have heard us talk about supporting countries along their journey to self-reliance. We believe that a robust private sector is essential for countries to achieve that. One of the reasons that the policy came about was that we didn't have a standard definition of what the private sector is or who it is. And I think that, you know, we use the term private sector, but it's not a monolithic kind of one thing. And so we're still having lots of discussions, even though we have a definition now. And it includes for-profit entities. They could be of any sector, financial institutions, investors, impact investors, business associations, businesses of any size, so private midwives, community pharmacies, PPMVs, everything up to a Merck, and any company in terms of US-based companies, South African-based companies, regional, kind of the whole gamut. But it's very focused on commercial. And I will say that that makes a lot of people in the health space uncomfortable. I would say, you know, even host country governments, there's a lot of people that think that the private sector is, you know, greedy, and so I think that the difference between health being a public good and the public sector providing all the health is kind of a mindset that we're trying to shift, right? Stewardship by the Ministry of Health is very important, but that doesn't mean that the public sector has to provide every single aspect of health. I think it also emphasizes that, you know, we have very close relationships with ministries of health, with NGOs, with academia, with civil society. This is not minimizing those relationships, but we have not strategically engaged the private sector in a systematic way where we're really bringing them in to tell us what they think and what we want to achieve. Just building on what people were saying before about the data, a secondary analysis of DHS data in 25 countries showed that 43% of caregivers for sick children go to the private sector as their first source of care. And we think that it's only the wealthy that go to the private sector, but in reality, the poor also go. And so, you know, we see in many of these countries that the out-of-pocket costs are very high, and it's usually the poor that is having most of that burden. So with this definition, then people say, well, where do NGOs fit in? Where do faith-based organizations fit in? And we know that in many countries, they provide the lion's share of health services. So in the policy, we talk about for-profit market-based approaches. And the idea is that we want to use the drivers' incentives of the markets to sustain these efforts rather than donor dollars. And so the idea is, how can we make the market be more efficient so that, you know, the market will continue way beyond USAID support is ever needed.
Yeah. So it's really about building these sustainable health market ecosystems, right?
Exactly.
And, I think I'd like to bring in, if you don't mind, I'd like to bring in Monique Fleder to the conversation, who's the practice manager to the Global Financing Facility, as We know you work closely with governments in setting up strategies, global health strategies, and would like to know how you're collaborating with your partner countries and what you're seeing and hearing from these countries when it comes to further integrating private local stakeholders in the health response.
Great, thank you so much for inviting me. Really great to see Marianne and so many other friends around the table here for this important discussion. And maybe just to start off by saying, for those of you that are not familiar, that GFF engages with countries to under country leadership, define what we call an investment case, a set of priorities of what needs to be financed in terms of the systems, the financing, the quality of care to deliver for women and children in country. And for us, the private sector piece is very much integrated. We were established during the Financing for Development conference in Ethiopia, and that private sector pillar from the beginning was very much at the heart of GFF. I'll talk specifically around the country approaches. And so mixed health systems is at the basis of how we work with governments around the investment cases. A large part of our support and financing in combination with the World Bank IDA financing is for the contracting of a comprehensive package of maternal and child health services that is delivered with very high quality. For that, we are really agnostic, whether it's public or private providers that deliver that. What's important is that we can ensure high quality of those services so that it has the intended impact. And we do that before COVID, and that continues now by supporting, really ensure a dialogue between public and private sector from the start, and go jointly into these design and prioritization processes. And understanding each other's culture and language is really important, and we can help facilitate that. And then to translate that into concrete actions and proposals that can be implemented, and we provide technical assistance then for the implementation of that. Now, when COVID happened, I want to segue a little bit to how COVID impacts these approaches, and this comes very much to almost every GFF countries. We're in 36 countries now. We do the private sector, health sector assessments, oftentimes in collaboration with other partners, and it's incredibly difficult to get really good data to make your decisions on. And so when COVID happened, we invested a lot in ensuring that we could measure what was the impact of COVID on the availability and the access to essential services for women and children. And across the board, we see about a 20 to sometimes 40% reduction in access to primary care services. And so that secondary impact of COVID has the potential of having even a worse impact than the COVID pandemic itself. And so the role of the private sector, and I was really fascinated listening to Aderonke and her experience in Nigeria, the role in the private sector is really, really essential there. And I'll give a few examples. One of them is that we're really struggling with the confidence of health workers to go into work because they're not able to protect themselves and protect their families from contracting COVID. And so the local production of PPE and making PPE, the protective clothing for health workers, available is very important. And we're close to finalizing some investments deal in collaboration with the private sector arm of the World Bank to ensure that Africa has higher local production of this protective clothing. We're also seeing a lot of disruptions, and particularly also in Nigeria, but many other West African countries, in the availability of commodities and because of the global supply chain interruptions. And so the ability to reduce the dependency of African countries on those the supply of those commodities from India, for example, and the investment in local production of those commodities is another really important area. And then when we come to the hands-on delivery of frontline services, we're seeing, particularly, for example, for family planning, that the private sector plays a tremendously important role. We have to think of different strategies when women are reluctant to access government facilities. What are different ways that women still can have access to family planning commodities? And the private sector here plays a really important role. And then maybe a final point is around the quality of care, and a lot of investment needs to happen in really seeing our role and supporting the government to play more of a regulating role to ensure that whether people access services in the public or in the private sector, they can access services of high quality. And so that's really where I see also where the global community can help further support to technical assistance and providing resources to ensure that when women access services, whether it's in the public or private sector, they receive services with very high quality. Thank you.
Thanks, Monique, and great insights indeed. And I like your point about data, even though it's different types of data. But I'd like to bring in Martinez from the European Commission Development Cooperation Office. Now, as the European Commission is one of the largest global development donors out there. It has come with a ambitious plan to leverage private sector funding through the European External Investment Plan. And you're coming to the end of it, the end of the first cycle that was for 2017-2021. You're preparing for a second cycle from 2021 to 2027, as you've told us yesterday in the conversation. And looking at your side, it looks like you've achieved most of the goals you had set, which was providing over 4 billion euro of financial guarantees, and you've developed over 140 projects of blended finance projects. And so we'd like to know what challenges you have faced in communicating with the private sector in the early days of the new investment plan, and how you're planning to do better in the next phase. I would say how you're planning to collect this data, how you're planning to get these impact anecdotes or data to even better engage the private sector in the next round.
Thank you very much, Alexander, for the nice introduction. I'm delighted to be part of this roundtable, and the reason is simple: global challenges that, like this dreadful pandemic, require collaborative approaches, and we certainly need to join forces and break the silos that sometimes separate governments from the private sector, the academia, and the civil society. I'm glad to share our perspective, our experience, and also I'm willing to learn from you all. You know that our approach in the EU is rooted in the European values and therefore guided by the purpose of achieving universal health coverage, UHC. On how important the private sector is for us, let me refer briefly to our current programs in this unusual 2020. The European Union and its member states acting together as a Team Europe are taking comprehensive action to tackle the destructive impact of COVID-19. Team Europe has mobilized almost 36 billion for emergency response and to address the health-related and the socio-economic consequences of the crisis. And we are partnering with businesses. Businesses are contributing in many ways. As Monique mentioned earlier, businesses are stepping up local production of medical and protective equipment in developing countries. And another example could be that they are offering services such as internet at a reduced cost or for free. In parallel to the Team Europe response, the EU is also being the driving force of the Access to COVID-19 Tools Accelerator, groundbreaking global collaboration to accelerate development, production, and equitable access to COVID-19 tests, treatments, and vaccines for all globally. So far, almost 16 billion euro have been mobilized in the form of loans, grants, warranties, and the private sector is being an essential part of this process for manufacturing and delivering these solutions, existing solutions or new solutions that will come. But as you said, there have been challenges, and we need to think of the post-pandemic landscape. So for us, certainly digital technologies and financial investments can help strengthen health systems and empower health workers to deliver quality care. As you rightly mentioned, Alexander, in 2020, we are finishing our financing cycle during which we have supported NGOs, the Global Fund, UNFPA, and the next long-term EU budget for the period 2021-2027, known as the Multi-Annual Financial Framework, MFF, will open new opportunities. The Commission has proposed a budget of around 130 billion for external action in the next MFF. And it's important to note that by virtue of the European Consensus on Development, there are several spending targets. For example, at least 20% of the EU ODA should go to human development and social protection. This includes, of course, maternal and child health. In the current MFF and in the future MFF, the external investment plan that you also mentioned, the EIP, is our flagship initiative to partner with the private sector. The financial arm of the EIP, the European Fund for Sustainable Development, launched recently, only in 2017, has already committed 4.5 billion and unlock 47 billion. Under the EIP, currently there is one health partnership. It's the African Health Diagnostics Platform, which is being rolled out in several countries in sub-Saharan Africa. This is a partnership between the European Commission, the European Investment Bank, and the Bill and Melinda Gates Foundation. It pays attention to laboratory and diagnostic services for primary care infectious diseases, but also for non-communicable diseases, and based on the public health priorities as defined by partner countries. To conclude, we believe that the involvement of the private sector is indispensable, and we have to reconcile public and private approaches because both are necessary. We also need both external resources and domestic resources. The private sector needs to be well regulated and integrated into national systems, because otherwise there is a risk of further fragmentation that leads to inefficiencies and inequalities. As I described, the EU is deploying new financing instruments, and these instruments will only be successful if we put them at the service of great ideas and if these ideas are well implemented. So we count on you, we count on our development partners, and thank you very much.
Thanks, Mar. Yeah, and then we'll look forward to continue collaborating with you then in reporting about these potential partnerships and opportunities for local private stakeholders to work with the EU where it's most needed in health specifically. I'd like to bring in Anshu to the conversation, as the World Health Organization has been obviously on the spotlight for the past few months. And Anshu, you're the director for the reproductive, maternal, newborn, child, and adolescent health and aging at the World Health Organization. It's a long title, but I'm sure you have a great perspective on these resources that have been redirected away from regular health service delivery towards the COVID-19 response. In that context, and what role do you see for the local private provider, and how is WHO facilitating the process, or is WHO involved in facilitating the process there?
Thanks a lot. And maybe just to say that I think the other speakers have provided the background why it's so important to involve the private sector. So WHO has started up a private health sector for COVID initiative, and has done two things. One, it has sort of created an action plan, and secondly, it's looked at a number of bottlenecks in order for the private sector to be properly engaged, let's say. So looking at the action plan, it sort of has said, it's a 6-point action plan, but it said that we should work together. In order for that, we should be able also to know what kind of private sector assets can be used to increase the capacity to respond to COVID, we should be able to look at how public and private human resources can be used intertwinedly, let's say, and be working in different kind of capacities and institutions. At the same time, all facilities and staff need to have the supplies in order to be able to engage and to respond. And then the fifth area is around establishing systems to integrate public and private response in order to have the let's say the mechanisms there, and then also to make sure that there's financing in order to ensure access. And so when it looked at policy challenges, basically the first one was that countries were actually not sure how to best include the private sector in planning for the national response. And so, for example, there are a number of countries where there is already existing private sector networks, where they already engage with them amongst themselves, and where they have engagement with the government. And so there it was much easier to pull in the private sector and engage them in the COVID response than in countries where this was done on an ad hoc basis, or where this hadn't been done at all. And so that was the first policy challenge, let's say. The second one was really around resource-based planning. And I think people have already highlighted this, that often we do not know which resources actually are available within the private sector. And so this basic lack of data is important, or is an important bottleneck, let's say, to overcome, in order to have an idea how many respirators, let's say, are available, how many staff are available with what kind of skills, etc. The third policy area or bottleneck was around the fact that the private health sector lacks certain resources and capacities for it to be really engaged or be an effective partner. So, for example, the government clinical protocols were not there, or medical staff were not updated and their capacities were not updated, or particular commodities such as drugs or testing kits were not available, or that PPE was not available. Mm-hmm. So that also was a challenge for the private sector then to be fully engaged. The fourth one was around emergency legislation that exists in country and therefore sometimes impedes that sort of, let's say, the engagement. So, for example, we have small pharmacies or small private sector providers who had, because already highlighted before, people were not coming anymore, so the demand reduced because people thought it was not safe to go, and so they would basically go bankrupt. And so there need to be policies in place to make sure that these private providers remain active and can survive, let's say, the pandemic crisis. At the same time, also, we had issues around market pricing. So, for example, government said that if you treat a COVID patient, this is what we can reimburse you, and it would be way too low compared to the actual price. And so then you create a perverse incentive for the private sector actually to not diagnose someone as COVID, because they would not get reimbursed what they would spend. And so that would also impede or be have a negative impact on the response to the pandemic. The other issue is, for example, that there would be HR policies that retired people couldn't be brought back into the workplace, let's say, and so you'd have to look into that. So, and the other one was there where government actually incentivized the private sector to do testing. Often the private sector wouldn't report, and so then that didn't allow us to have a good idea of where the pandemic was and where the cases were. The fifth challenge highlighted was around financing. And so I've already highlighted one example, but for example, in certain countries, in-kind donations were provided, but not actually financial support. And for example, let me stop there. And let me give you just two examples where WHO has been active, let's say. So we have, with support from Merck for Mothers, we have been working in Ghana, looking really at how to engage the private sector. And with the GFF, we've been working in Ethiopia. And for example, in Ethiopia, the activity undertaken was really to engage the private sector association, the private providers association, to see how they can engage with the government and establish that dialogue to get them involved.
Great, thanks, Anshu. And I'll go back to these data points that you've mentioned, the data that you may need, the data that may lack from the private sector side. That's something Susan touched on as well in the conversation we had yesterday, to better engage with the private sector directly. Before we go there, I'd like to get the floor to Annie, and Annie's the Chief Investment Officer of the Grand Challenges Canada. And we've seen, and we're seeing now in the COVID crisis, how health innovations is important. And it's also very important in maternal health. And so I would like to know how you're providing financings to health innovations in the private sector, and what impact do you see with it? So very briefly, Annie, if you can help us with that and see what type of data that you're sharing, what type of storytelling you're providing to help engage the right private sector stakeholders.
So for those who are less familiar with Grand Challenges Canada, what we do is we finance innovators with grants and loan and convertible loans. And that ranges from non-for-profit organizations that are looking to scale their new idea via a government or larger NGOs, but also social enterprises and technology startups that are developing new treatments, new medical devices, new technology platforms that are perhaps more efficient and can reach more people at the bottom of the pyramid. And our guiding principle is really that our capital has to go towards reaching people who need it the most in the country, and often that will involve working closely with government funders. In terms of how we do it, it's really about right capital for right activity. And so recently as last year, we looked to our framework and really tried to improve it in such a way that when we look at a social venture or a startup, we look at its valuation potential on one axis, and we look at the use of funds on the other axis to determine, for example, if we're looking at a technology platform that has large scale global potential, could be a huge win. We consider that very differently from a local hospital that is perhaps very early stage and only serving bottom of the pyramid populations. Similarly, we look at our activities, and if we're funding activities that are strictly focused on bottom of the pyramid or perhaps measurement and evaluation, we evaluate that very differently from collecting data for a clinical trial that serves to grow the company for the long term. And so that's really the input that our deal leads will consider in designing a financing structure for an innovation that comes on our desk. To answer your other question as well, why we think it's important to fund these social enterprise and startups, so to speak, because it can sometimes look at it a little odd from the outside in when we're trying to really focus on bottom of the pyramid populations. But why we think it's important is we see that private sector solutions are often aimed at being more efficient, doing more with less. They're often, what's interesting is our role can be catalytic in terms of making sure that the founders can, continue on their vision of reaching bottom of the pyramid populations, even whilst they raise private capital, because we know that they face pressure often from investors to focus on the higher income populations. So our presence, as an investor in the venture can help with that. And the other piece that I should highlight is what we like about private sector solutions is that they can be very flexible on meeting the needs, whereas government providers, they have a basket of services that's been approved a long time ago by a heavier process, whereas the sort of smaller hospitals, the local pharmacies, they just meet the need. If they see a lot of patients come in with a certain need, they can just address it, and it's just done. So we like them for that reason, but we do wherever possible ensure that they plug into the greater ecosystem when we fund innovators. One piece towards the future, perhaps, that I could say is that where we see we fund very early stage innovations. So, there's a little bit of proof point. We help them gather more proof points so that they are ready to scale. And we do see a big gap in terms of financing for social enterprise and companies that can be impactful, so that they continue to have impact capital. And what we're really working on these days is launching investment vehicles that are both for philanthropic investors and for-profit impact investors to really provide capital at the seed, Series A, and Series B stage. And that's particularly important, we see, for those that are developing evidence-based solutions. So think about solutions that need FDA approval, but also larger technology platforms that can serve, I would say, greater needs for sort of system level improvements. I'll pause there.
Thanks, Annie. That's great to hear that you're supporting social entrepreneurs, and you work in over 100 countries with your since you started Grant Changes Canada. So it's a great inspiration there. And we'll definitely keep reporting on what you do and involve you in this conversation. I'd like to go to Desta, who's joining us from Kenya today. Desta Laku is Director of Partnerships and External Affairs at Amref Health Africa, which is one of the largest international NGOs based and headquartered in Africa. And Desta, it's great to have you and kind of close in this first round of comments on this, as you also work a lot in the ground with a lot of community health workers. And I like to put things back into perspective and maybe reflect on what Adoranke and others have touched on the role of the private sector to provide maternal quality healthcare, and how do you partner with the private sector as an NGO? And it'd be good to have your say on that.
Thank you very much, Alex. I hope you can hear me, and good evening, good morning to those of us, those of you who are on this call. I think Amref has sort of a unique position, and we're not a private sector, but we have been working for quite a long time with the private sector and also public sector. And when you think about who is the local private sector, Susan mentioned earlier that, we're still trying to define it and further clarify that. So we are doing that. So what we do is we actually work at the intersection of those who provide service, first level service, to those who have no service or hard to reach communities in general. And the difference, I think, for us as an NGO and a large NGO in Africa is that we actually work across the key pillars of the health system. So our partnerships are essentially aligned to what is needed across those key health, pillars in the health system. So, for example, when we look at the current pandemic, it's just shown us how fragile our health system is, and it's given us pause to think about not just how do we bridge the gap that's existing today with COVID, but how do we think more strategically and longer term with our partners to ensure that these gaps are managed for the long run. And we know that without primary care, we can't have UHC. So we have always believed in working with partners, looking at market-based solutions where possible, but really co-creating the partnership so that it works for the community first and foremost, and it is something that Amref can deliver on and meets the needs of the private sector partner, right? So our primary focus, since we're looking at health systems strengthening and the health system pillars, are training of frontline providers and health workers, for example. So this would include things like building the capacity of private providers on clinical protocols and updates. For example, now in COVID, in the current situation, we're ensuring that the primary care providers are receiving government guidelines and to address and adapt patient care as needed. So that's one area, which is a very big area for us, where we work with private sector partners and have been for quite some time before COVID, during COVID, and we continue to do so after COVID. So it's really training providers, training frontline community health workers, training midwives, training traditional birth attendants, who are the ones who are referring, women in the community for INC and delivery services. So we work very closely across that level. That has not changed for us, and we continue with the same partners, and also now newer partners who are now providing support for PPEs, for example, because many of our community-based health workers especially are fearful. There is a stigma around COVID, and that impacts care delivery, and it impacts access to essential services. So we've seen that, and we are working very, very closely with the community to do risk communication and also delivery of PPE where possible, working, of course, closely with the ministries of health. I think more importantly, what we've seen in terms of the work we're doing with our partners are really around how we're now able to leverage technology to deliver, the training that's needed. So we're using mobile platforms that we already have in-house, for example, such as Leap and Jibu, but we're working very closely with the telecom industry. So when we think about private sector, it's not necessarily, a doctor who sits in an office somewhere waiting for a patient to walk in. It is actually all of those other industries that support the health space. So we work very closely with private sector like Safaricom, which is a Kenya-based company, to Orange, which is a more international telecom provider. And with them, for example, we provide, they provide network access for data collection. They provide support for telemedicine. We work with multinationals like Microsoft, who are providing us with platforms for communication across the different offices, the different regions, with our partners, etc. So we're leveraging mobile technology platforms and partners to jump in, not just for COVID, but certainly for COVID, but just longer term. Those are the partnerships that we have. So in this way, we're able to collect data, provide distance support, etc. Then, of course, and I don't know how much time I have, but we're working with other sectors also, those who are working in the water and sanitation area, companies such as Coca-Cola or others who are providing support for, water and hygiene. We are working with companies that are doing soap and hygiene manufacturing. In Kenya alone, if I can give you two examples where we've really leveraged our partnerships and really transformed things. We've worked in Kenya. There's a project that we started with called Wheels for Life. It's a public-private partnership. We work with the government, we work with private sector, with foundations, with the Healthcare Federation, with media, fleet services and ambulances. And Wheels for Life actually specifically is focused on maternal care and access to maternal care for Kenyan women who are pregnant. So for example, since we launched this in end of April 26, we have already received over 12,000 calls. So this is, because of COVID, restricted time, curfews, etc. But you could call Wheels for Life and you can get access to antenatal services or delivery services. So since April, we've had more than 12,000 calls. We've had more than 1,000 women assisted by doctors, about 150 ambulance trips, over 500 cabs dispatched, etc. And all of these women, 90% of these were deliveries. So it's really, how do we act fast? How do we leverage partners, local partners as well as regional partners, to deliver service? So this is one sort of very specific example about Kenya. And then we have a more regional example with the National Business Compact on COVID, which I'm happy to go into, but that looks at a range of different partners that we're able to pull together. And these are partners that are not necessarily health related, but hygiene and soap manufacturing companies, communication companies, agencies and associations. So it's really leveraging the folks who are in, current partners and new, and aligning them to delivery of service.
Yeah, and it's really interesting. It really showcases how hard it is to capture the level of investment that's put in the private sector and by the private sector to help improve these maternal health goals. Because as you say, some of them are not the natural players that we can think of. When you mentioned Coca-Cola, I know the Global Fund has a partnership with them as well on supply chain, on sanitation. Looking at technology was important for you as well to talk about training capacity. It was one of the main conversations in some of the previous panels and the polls we've run. We only have 5 minutes before closing the conversation, so I'd like to bring him back Aderonke's perspective and really just a few words, maybe in a sentence or two. What's your takeaway from this conversation, and where do you see any opportunity for you to, or for your type of organizations to further partner with the donors that we have around the table? And then I'll ask a very quick question for you. It's actually a very big question. I'll ask you to answer very shortly about what are some of the gaps you currently see standing in the way of the reporting of private sector engagements that you're doing and its impact. And so Aderonke, yeah, please, if you could just share your few initial comments on the conversation we had today.
Okay, thank you very much, Alex. I think it's been a very enlightening conversation, and seeing that people, organizations are becoming more open to partnering with the private health facilities, seeing that they play a big role in the health system. And considering the data reporting, well, I think one thing that we've been able to achieve with the Integrate E project is the data reporting, and I think, but one of the gaps, I think I'll talk about the gaps before I talk about the possible solution. When we started out the project, it was manual, there was this manual reporting where you had to fill in, anytime you attend to a client, you fill it in a book and all. But over time, as the project progressed, an app was developed. I think it's called the District Health Information System app, where you're able to upload your data. After you've gotten your data for the month, you upload the data on the app, and it's like a central database. So from that database, the reproductive health coordinator for the state can access the data there and collate the contribution of the private health facilities with that of the public health, so that you have a better picture of what is going on as regards family planning services. So I think one way is will be to digitize the system, pretty much like what the DHS app is doing. Make it less cumbersome. I don't know if there's a way you can make it, as you seeing the client, you entering it into the system, is going straight to the database. So there is a connection connecting. If there's a way to connect the public health facilities with the private health facilities, because I think one of the challenges of data we have with data reporting now is that beyond providing the service to the client, the data reporting seems like a different job function. Some private health facilities actually have to employ a particular staff whose focus is on data reporting, so that they can adequately capture the entire data. But I believe that if there's a way that we can, like a central database, connect all the systems, so that as the service is being provided and you are imputing it, it's going straight to the database, make it less cumbersome. I think that's the word.
Thanks, Aderonke. Yeah, it looks like this issue of data gathering touches all of us at all levels of the global health and health response capacity. And well, I'd like to, I'm not sure we have the time to go through that last question I wanted to ask you all, and about the reporting on the engagement of the private sector, because we have so many participants today. But maybe I'll invite Marianne to reflect back on that and share a call to action with all our participants today. We'll also keep reporting on these issues on a regular basis, but Marianne, do you want to go ahead, and do you want to ask this quick question to everyone, or just go for a call to action?
Sure. My big takeaway from this roundtable is we need to have a follow-up session. I feel that I have learned so much, about what is happening in each of your organizations that, I was not aware of. And I think that if that's the case for myself, it's probably also likely for a lot of other people not understanding the extent of work and collaboration, that's already happening. And to just link it back to Alex's original point about what happens next, what we are hoping is that we can figure out a way to collect this information in a way that's value add and actionable by stakeholders such as yourself. And so whether it's just, being able to understand the totality, of the diversity of collaborations with local private providers, whether it's being able to understand the totality and diversity of their contributions on the front line, whether it's able to understand what works and what doesn't work in terms of collaborations, and in terms of impact on health. I think that this is information that is very valuable. I know at least it's valuable to an organization like MSD for Mothers to inform the type of work we do, our strategy and our investments. I don't think any of us wants to recreate the wheel, or duplicate duplicate work that's already been done, when we can share and learn from each other. So in terms of next steps, I do think it would be helpful to hear back from all of you, around best ways, to kind of collate and share what we're doing and identify the types of data that is valuable to share. Because at the end of the day, we don't want to just be collecting for collecting's sake. We want to be collecting data that's valuable to each and every one of you. So thank you.
Marianne, maybe I could just make one invitation. USAID just spent the last year developing a private sector engagement evidence gap map, which was recently launched. It is a living document that we want to have people contribute, whether that's gray literature, whether that's project reports. And so that platform already exists, and we would welcome anyone to add to that. And I'm happy to share links out with people afterwards.
Thank you, Susan.
Oh, thank you,
That's
Susan.
exactly what we want to happen.
Yeah, and you can also share it, I guess, on social networks using hashtag on the front lines. And I'm pretty sure that our production colleagues, Julie and Natalie, have shared it on the Hopin platform where participants are joining from. So thank you, and thank you all for your time. And you all have very very busy schedules, and do not have time to speak much at this conversation. But it's really a start to further engage you in conversations we'll have for the year to come. Really, almost 18 months to come. We'll be reporting on these issues on a regular basis to really try to help building sustainable local health ecosystems between private, local stakeholders, public authorities, civil society organizations, and international players. So it's really what we're going to try doing, reporting on the funding that's made available in that space, try to engage all of the key stakeholders, and also take the opportunity to thank all of the other speakers, all of the Devex colleagues, and our partners at MSD for Mothers, Smile Train, and J&J, who made that event possible. If you want to follow what's happening in this broader space or topic around health workers, we invite all participants to continue following the series Duty of Care. And if you want to really contribute to this work that we're doing on reducing maternal death and child death, follow the Maternity Matters series, Funding the Future, for big insights on funding around these issues. And we'll definitely follow up with you all at USAID, GFF, European Commission, Grant Challenges Canada, AMREF, WHO, and all partners who joined us today to make this this event a great starting point for conversations we'll have in the future.